Governor Newsom announcing hospitals and healthcare facilities can soon begin to schedule certain elective surgeries. This is the state's first step in easing coronavirus restrictions. The allowed procedures are those deemed essential, such as heart valve replacement or tumor removal. There are certainly fewer organ transplants happening right now as doctors focus on coronavirus patients. CBSN Bay Area's Kiese asked a doctor about the increased dangers for transplant patients and the steps being taken to keep them safe.
Joining us now is Dr. Peter Maag, the CEO of CareDX. Dr. Maag, some of the most vulnerable people living through this pandemic are organ transplant recipients, but that's not their only risk. Can you explain?
Well, now with the COVID-19 crisis, transplant patients are worried. You know, they're always worried about the health of their transplanted organ because once they have an organ, they're going to receive immune suppression for the rest of their life. That pretty much keeps them healthy because they're constantly battling between this risk of rejection and all the other things that are going on. And now with COVID-19, because they are immune suppressed, they're part of the vulnerable population. So they really worry about, should I now go back to the transplant center and get my regular surveillance visit? Now, CareDX is helping transplant centers and transplant patients to perform these regular surveillance visits with our very novel diagnostics. So transplant patients are really worried about right now with COVID-19.
So this remote blood draw program could be the answer. Could you tell us a little more about the program your company developed?
Well, you know, in the past, we have had already about 10% of patients that were being remote monitored with our mobile phlebotomy, with our blood draw solutions that are home-based. But now this is 10x. We really need to lean in and have more transplant patients receiving this regular surveillance visit blood draws by a convenient location in their home. And so now CareDX is leaning in and making sure that these transplant patients are being cared for by doing a simple blood draw from their home, which they tremendously appreciate. The feedback has been phenomenal.
And how can you sign up?
Well, it's a very simple sign-up process, remotrack.com, CareDX, remotrack.com, and then we'll be coordinating with your transplant center, making sure that there's somebody coming to your home, get the blood draw, and the results come back to your transplant center. And then your clinician can determine, do you need to come in or should you stay at home? And maybe we can even do with a simple telehealth service, actually via phone again, the clinician can conduct the regular surveillance visit, which is a tremendous relief to many of these patients.
It seems so, and right now people are looking to help out in any way that they can during this pandemic. Do you need volunteers?
Well, you know, we've hired a number of patient care managers. There are a lot of transplant nurses, a lot of individuals in the transplant community that are now coming to help. Yes, we are constantly looking for individuals that are helping us to care for these patients because they're very worried, and it's such a vulnerable population. If you receive a transplant, you're really in need for regular surveillance.
And Dr. Maag, is there anything else you would like to add?
Well, it's amazing to feel the community coming together. The transplant ecosystem right now is full in caring for these vulnerable patients. And while everybody is worrying about COVID-19, we should remember that there's also patients that just need our help. So nobody should be left alone. There's a lot of anxiety going on, and as we, as the transplant village, come together, we can really care for each other. So this is the moment to really lean in and having more interactions rather than leaning back and being isolated.
Very important right now. Dr. Maag, Dr. Peter Maag from CareDX, thank you so much for joining us.